I was not born in Ohio, but pretty much raised in Ohio. I went to Boston College for undergraduate, stayed on to do a master's to complete my senior thesis, research thesis, got a research master's in neuroscience. Then I went to med school at Case Western Reserve. During my med school year, I took a year off to go do research at the NIH. I was awarded a Howard Hughes NIH research grant and went down to the NIH and spent a year down there working in one of the labs. After that, I came back, finished med school, then went to residency through Case Western at Metro Health and the Cleveland Clinic. I wasn't initially planning to be an OBGYN. I was going to become an ophthalmologist. I had done retinal research as part of my master's, and I actually did an elective before I did my OBGYN requirement for med school. So I did an elective in ophthalmology, but then when I did my rotation in obstetrics as a medical student, that's what really drew me to the field. The obstetrics is what really drew me in. The OB, delivering a baby, it's just, even to this day, that's my favorite thing to do. It's just such a miracle to give birth to a baby or to see a baby be born. So that's what really drew me in. But it has a nice combination of medicine, surgery, and the obstetric piece of it. So it really encompasses kind of all aspects of medicine. Probably the most unique service in terms of this area is the robotic surgery. We're the only hospital in this general area, being north of 70, that offers that, or Premier is the only facility that offers that in this region. Robotic gynecology, so hysterectomies, minimally invasive, more complex laparoscopy for things like endometriosis. I mean, my philosophy of care is the patient, taking care of the patient. That's a part of medicine that I enjoy the most, is teaching, educating the patient, getting the patient involved in their own care, and really spending time with the patient. The biggest thing that I learned from patients is taking a good history. Usually you can figure out your answer to your question or the problem that a patient's coming in for just by listening to them, not by necessarily the clinical exam, although that adds a good piece of it. Unfortunately, time constraints with modern medicine does hamper that a bit, but it really is listening to the patient, trying to search out why that patient is there, what do they want from you. The support staff, including just from the moment somebody arrives at the front desk, they really set the tone for how the appointment is going to be. Just a smile on their face, letting the patient know that it may be some time so the patient doesn't feel like they're forgotten or their time's being wasted. To the nurse who is rooming the patient, gathering the vitals, just really setting a tone for making the patient feel comfortable. So the staff really adds that piece of the appointment. You could be on your best or doing your best that day, and the staff can ruin it for you, and vice versa. The staff can be upbeat and real positive, and then you come in a bad mood. So sometimes we offset each other by doing that, but the staff really does play an important role in that. Our practice has a lot to offer in terms of multiple providers, in terms of the robotic, minimally invasive surgery. We have a great hospital in Upper Valley with a lot of support staff and a lot of just good people that work here. So it's not just about the medicine as well, but it's about the personalities and the caring of the patients.